and welcome. In this video, we are going to practice recalling knowledge on endometrial cancer. On every slide, you will be given a question and then you will be given 10 to 15 seconds to answer the question. After 15 seconds, the bell will ring and the answer will be shown to you. It is recommended that you answer the question verbally, or you can keep a piece of paper with you and just write the bulleted points of the answer. Or you can do an audio recording of all your answers so that you can play back and confirm the correctness of your response. Please give feedback if this method of revision is helpful for you. We would request you to subscribe to our channel and send comments. So let's start. This video is about the treatment of endometrial cancer. The first question is, how is endometrial cancer staged? The answer time starts now. So, endometrial cancer is surgically staged and pathologically examined. In all stages, the grade of the lesion, the histological type, and the lymphovascular space involvement must be understood and recorded. Before surgery, the extent of the tumor is assessed through imaging. If available and feasible, molecular classification and testing for the POL-MUT, MMRD, NSMP, and P53ABN is encouraged in all patients with endometrial cancer for prognostic risk group stratification and as factors that might influence adjuvant and systemic treatment decisions. It may not be important for you to actually remember each and every molecular classification method, but you should know that molecular classification has now been added to the endometrial staging by the International Federation of Obstetrics and Gynecology Endometrial Cancer Classification for 2023. Moving on. Why did FIGO present a new classification for endometrial cancer? Your answer time starts now. So since 2009, when the last classification was released, there have been many new discoveries about endometrial cancer. The Cancer Genome Atlas data has provided more information about its different types, how they behave, and their genetic characteristics. The updated 2023 staging of endometrial cancer includes histological types, tumor patterns, and molecular classification. And this new staging system aims to better classify and treat the different types of endometrial cancer based on this true knowledge or new knowledge. The next question is, what is the FIGO 2023 staging system for carcinoma of the corpus uteri? Your answer time starts now. The simplified version of this new classification is that in stage 1, the cancer is confined to the uterus and to the ovary. In stage 2, the tumor invades the cervical stroma but does not extend beyond the uterus. In stage 3, the tumor now spreads regionally and any histological subtype, and there may be involvement of the vagina, parametrium, or pelvic peritoneum, metastasis to the pelvic or para-aortic lymph nodes, or both. Stage 4, spread to bladder mucosa and or intestinal mucosa and or distant metastasis. What is the importance of staging in endometrial cancer? Answer time starts now. Based on the results of the investigation, the cancer will be staged according to the International Federation of Gynecology and Obstetrics staging system. Staging helps determine the extent of the cancer and guides treatment decisions. The specific investigations and their order may vary depending on the individual patient's circumstances, including the grade and the stage of the cancer, the patient's overall health, and other factors. It is essential for the healthcare team to evaluate carefully each case and tailor the investigations and treatment plan accordingly. These treatment plans should be made by the gynecology oncologist in consultation with the tumor board. Next question is, what is stage 1 FIGO staging of cancer of the endometrium 2023? And the answer time starts now. This is a very important question because you may be presented with a scenario of the spread of endometrial cancer, and then you have to determine the stage, and you have to also determine what is the appropriate treatment for that stage. So let us try to understand what is the meaning of stage 1 endometrial cancer according to 2023 classification. In stage 1, the cancer is confined to the uterine corpus and the ovary. And stage 1 is further subdivided into 1A, 1B, and 1C. In 1A, it is further subdivided into 1A1, 1A2, and 1A3. 1A1 is non-aggressive histological type. 1A2 is again non-aggressive histological type with a greater involvement of the myometrium, and stage 1A3 is low-grade endometrioid carcinomas. When we come to stage 1B, these are also histological non-aggressive types with invasion of half or more of the myometrium. And 1C is aggressive histological types limited to the polyp or confined to the endometrium. What is the meaning of stage 2 endometrial cancer according to 2023 classification? Your answer time starts now. In stage 2, FIGO, and according to FIGO 2023, there is invasion of cervical stroma with extrauterine extension or with substantial lymph vascular space involvement, or aggressive histological types with myometrial invasion. Stage 2 is further subdivided into 2A and 2B. In 2A, the cancer is non-aggressive and is involving the cervical stroma. In 2B, it is also non-aggressive, but now there is substantial lymph vascular space involvement. 2C is an aggressive histological type with any myometrial involvement. So A, B, and C, three subtypes of the stage 2 carcinoma. In stage 3 carcinoma, what is the FIGO staging? stage 3, there is local and or regional spread of the tumor of any histological subtype. In stage 3, 3A is divided into stage 3A1 or 3A2. And and these are actually depending upon the extent of the involvement. It is either 2A or it is 2B when it is involving the vagina and the parametrium or the pelvic peritoneum, and stage 3C when it is further involving the pelvic or the para-aortic lymph nodes or both. Stage 3 is then again subdivided into C1 and C2 depending upon the metastasis to the either to the local lymph nodes and or to the para-aortic lymph nodes up to the renal vessel with or without metastasis to the pelvic lymph nodes. So now micrometastasis has also been added to the classification, which means special techniques have to be applied according to the World Health Organization recommendations for histological classification. And so even micrometastasis and macrometastasis are both important in this classification. Stage 4, what is the meaning according to the latest classification? Your answer time starts now. Stage 4 disease now has spread to the bladder mucosa or the intestinal mucosa, or there is distant metastasis. And stage 4 is further subdivided into A, B, and C. With A, it is bladder or intestinal or bowel mucosa. With 4B, it is abdominal peritoneal metastasis beyond the pelvis. And stage 4C is distant metastasis, including metastasis to any extra or intra-abdominal lymph nodes above the renal pelvis, mostly to the lungs, the liver, the brain, or the bone. Let's talk about the treatment of stage 1 endometrial cancer. What is it? Answer time starts now. So in stage 1, the treatment is usually total abdominal hysterectomy and bilateral salpingo-oophorectomy without vaginal cuff resection, using either a minimally invasive surgical approach or using a laparotomy approach. The decision is made after complete evaluation of the patient who has already had an initial diagnosis with histological typing of the tumor, as well as all the investigations to identify if there is any spread of the disease either locally or outside the pelvis. So stage 1 treatment of hysterectomy is only for non-aggressive tumors. If the tumor is aggressive histologically, then it is going to shift, or molecular classification shows that it is a highly malignant tumor, then the treatment will change. And so these decisions are made by the gynecological oncologist. And if the patient is lucky enough to be in a center where molecular classification can be applied, then indeed the treatment will be very satisfactory. What is the treatment of stage 2 endometrium cancer? Your answer time starts now. So radical hysterectomy, pelvic lymphadenectomy, and pelvic lymph node dissection with adjuvant radiotherapy would be the recommendation for stage 2 endometrial cancer. The decision is made after complete evaluation of the patient who has already had an initial diagnosis with the histological typing of the tumor, as well as the advanced diagnosis based on all the investigations to confirm the extent of the disease in the pelvis and outside the pelvis. Okay, so the next question is, what is the treatment of stage 3 endometrial cancer? And your answer time starts now. Women with stage 3 uterine carcinosarcoma often have the same type of surgery that's used for high-grade cancer. After surgery, radiation, chemotherapy, or both may be used. The chemotherapy often includes the drug paclitaxel and carboplatin, but ifosfamide along with paclitaxel or cisplatin may be used. What is the treatment of stage 4 endometrial cancer? Your answer time starts now. If diagnosed with stage 4 endometrial cancer, surgery will not always be required as an initial management response. Instead, chemotherapy, hormonal therapies, immunotherapy, and sometimes radiation therapy will be used for the initial management. Where it is appropriate, the patient may be included in clinical trials where another drug or different type of drug will be added, and these clinical trials are hoped to have better results with a new classification, and to have a better understanding of the course of the disease and the response of the disease in different kinds of presentation. Is the management of recurrent endometrial cancer? Your answer time starts now. Standard management involves surgery followed by chemotherapy and or radiation therapy. Hormonal or immunotherapy may also be considered. For recurrent disease, the gynecology oncologist will have to present the case to tumor board to agree on the ensuing treatment, which may be any of the following: secondary cytoreduction, chemotherapy, hormonal therapies, immunotherapy, radiation therapy, and if appropriate, the patient may be included in clinical trials for a special kind of treatment, and this has to be consented by the patient. Prognostic factors for improved long-term are absence of residual disease. What are the complications of endometrial cancer? Answer time starts now. So, like all cancers, endometrial cancer, if left untreated, will progress to metastasis and eventual demise of the patient or death of the patient. However, treatment may also be associated with complications, and depending on the treatment, the complications will be present. All the complications will increase if there is underlying morbidity related to hypertension, obesity, diabetes, and increasing age. The risk of thromboembolism is also increased in cancers and in obesity. Is the prognosis of endometrial cancer? The answer time starts now. So with the new classification, it is now becoming more complex to understand the prognosis of endometrial cancer. And there are different factors that are going to influence the prognosis, and these include the stage of the disease, which is the most important prognostic factor. Histological subtypes such as clear cell and papillary serous adenocarcinomas have a poor prognosis. Grade is important, and poorly differentiated adenocomponent influences prognosis negatively. The findings of peritoneal cytologic evaluation appears to be an important prognostic factor, and lymph node metastasis has poor prognosis. What is the role of molecular classification in endometrial cancer? Your answer time starts now. So this is not an essential part of the knowledge that you must have for examinations or as a generalist, but it would be interesting, and for those of you who are interested, I will give some detail in this answer. When it is feasible, the addition of molecular subtyping to the staging criteria will allow a better prediction of prognosis in staging prognosis scheme. So what is POL-MUT? So POL-MUT, as far as molecular diagnosis is concerned, is polymerase epsilon mutated carcinomas. These are rare carcinomas, but well-known subtype of endometrial cancer. While typically associated with good prognosis, recurrences are documented. MMRD is mismatch repair deficiency, is a common pathway of malignant transformation, accounting for approximately 15 to 20% of human carcinogenesis. And NSMP is classification according as a copy number, which is referred to as non-specific molecular profile. So, and P53 is a dysfunction of P53 is associated with carcinogenesis in cervical and ovarian cancers. In endometrial cancers, it is associated with a poor prognosis. So as a general response to this question, you should know at least this much, that the performance of a complete molecular classification is encouraged in all cases of endometrial cancer for prognostic risk group stratification as potential influencing factors for adjuvant and systemic treatment decisions. Where molecular classification has been done, then POL-MUT will denote a favorable prognosis, whereas MMRD and NSMP will indicate an intermediate prognosis and will therefore not alter the stage, but P53ABN indicates a poor prognosis. So the last 2 points are important for you to understand as well as the first point, but the remaining understanding of exactly what each and every one of these molecular diagnostic processes are is not necessary for a generalist. What is the role of surgery in endometrial cancer? Answer time starts now. So standard management involves surgery followed by chemotherapy and or radiation therapy, whereas hormonal and or immunotherapy can also be considered. For recurrent disease, the gynecological oncologist will have to present the case to tumor board to agree on the ensuing treatment, which may be one of the following: secondary cytoreduction chemotherapy, hormonal therapies, immunotherapy, radiation therapy, and following the new classification, inclusion in clinical trials is possible, and prognostic factors for improved long-term are absence of residual disease. The role of pharmacologic therapy in endometrial cancer. Your answer time starts now. Treatment of endometrial cancer needs to be individualized depending on patient factors and disease stage. Although surgery is the mainstay of treatment for most cancers, non-surgical treatments such as radiation therapy, chemotherapy, and hormonal therapy can play a role. These therapies are used as adjuvant or adjunctive therapy in the treatment of recurrences or metastatic disease or in patients who are unable to have surgery. Tumor board with the multidisciplinary group will guide the treatment. What is the role of radiotherapy in endometrial cancer? The answer time starts now. It is not necessary to have a very complete assessment about the answer for this question. However, you must have some idea about the different kinds of radiotherapy that are used in the management of endometrial cancer, and you should have also a better understanding of the very common methods of radiotherapy. So in advanced cases of endometrial cancer, radiation therapy may be used as part of the treatment approach. The type of radiation therapy used and its specific application can vary depending on the stage and the extent of the cancer. The patient's overall health is also important and some other individual factors. The different methodology of treatment with radiotherapy includes external beam radiation and systemic therapy with radiation or palliative radiation therapy. With this, we come to the end of the video. If you like the video, then please subscribe to the channel, press the like button, share, comment, and press the bell icon for notification of further videos. Thank you and goodbye.